Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Cancer Center series, a special collaboration between the Blum Center and Mass General Cancer Center. Before we get started, just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. Okay, so next I would like to introduce you all to Dr. Kelcie Willis. Dr. Willis is a clinical psychologist in the Department of Psychiatric Oncology at Mass General Cancer Center. She is also completing a National Cancer Institute-funded research fellowship in training in oncology population sciences at the Dana-Farber Harvard Cancer Center. As a member of the Cancer Outcomes Research and Education Program at Mass General, Dr. Willis collaborates with an interdisciplinary team of investigators to develop supportive care interventions for both patients with cancer and their caregivers. She joins us today to give a talk on caring for yourself while caring for someone with cancer. So please join me in welcoming Dr. Willis.
Thank you, Amy. Thank you so much. Let me get my slides up. How's that, Amy? Good. Okay, awesome. Well, welcome all. I can't see you, but I know we've got different people logged on today, and maybe you're watching this later. It's an honor to be with you today via Zoom, talk about a really important topic near and dear to my heart, which is caregiving. Amy gave a wonderful introduction. As she mentioned, I am a clinical psychologist. So I work with patients at the Cancer Center to help with any quality of life need that they may have. So sometimes it's helping them with difficult emotions, or sometimes it's helping them with their sleep. And I also do research at Mass General as well. I'm part of the Cancer Outcomes Research and Education Group, or CORE. So that's a little bit about me and sort of the point of view that I come from. And I wish I knew a little bit more about you. If you're a caregiver, if you're a patient, if you're a provider, please note that this is a session for caregivers. So if you are a patient or a provider logged on, welcome. It's so lovely to have you. And maybe this presentation will give you sort of a different perspective to think about. But I'm going to be speaking directly to our caregivers today. So I won't be able to see you, but I have an activity for us to start. If you're a caregiver, I want to know if any of these items resonate with you. So, at any point since the diagnosis, have you cried by yourself or with others? Have you felt completely overwhelmed? Have you had difficult sitting with uncertainty? Have you felt hopeful? Unsure of how to take care of something? Notice strength in yourself that you did not know you had? Maybe had trouble sleeping? These are all experiences we hear from our caregivers. And we know that the caregiving experience is rich and filled with both positive and negative experiences and a whole variety of tasks. So I have this slide here of all the different things caregivers are often in charge of. So they're taking care of the patient medically, they're talking to providers, they're getting their loved one to the hospital and back for appointments. But they're also taking care of the household and maybe doing extra chores that they weren't doing beforehand. Maybe they are helping the patient with their emotions while managing their own emotions. And they're doing all of these things while somehow trying to take care of themselves. You see that self-care box in the bottom with some question marks. It is really, really hard to do. It's really hard to balance all of these different tasks. And a lot of times these tasks can just kind of be hurled your way. And more importantly, the caregiving experience does not come with an instruction manual. So you're learning how to become a nurse and a patient advocate, and a caretaker and manage finances, all at once. And there's no real instruction on how to do so. So I just say that to pause, to validate that this can be really hard, at times, yet also really, really meaningful and rewarding. And please know that I see you and that you are doing your best with little instruction. Because caregiving offers unique challenges, we have developed the Caregiver Research Program at Mass General through the Cancer Outcomes Research and Education Group. You can see at the bottom, our director is Dr. Jamie Jacobs. She's a mentor of mine. You can see our website on the right-hand side. And our mission is to bring together clinical researchers who share a passion for supporting the network of people surrounding someone with cancer. So we know that cancer doesn't exist in a vacuum and it affects many people. So what we try to achieve in our caregiver research program is we try to first understand the unique experiences of distress by family members and friends caring for someone with cancer. So, what exactly are they going through? When do those feelings start? When do they get worse? When do they get better? And once we understand the specific problems that they're facing, we then seek to try to develop programs to improve those issues, to improve their quality of life, and to integrate these programs clinically so that they don't just exist in a grant proposal or in a research project, but that they exist all the time at Mass General and beyond. So it's a big task, and we're working on helping as many caregivers as we can. And I want to share with you today a little bit what we have learned both about the caregiver experience and strategies to support them. So we know through the research that caregivers have sometimes more unmet psychosocial needs than patients. And I have some data on that I'd like to share with you here in a moment. We know that caregivers' needs are sometimes overlooked and secondary to the patient. We know that there are few interventions to improve caregiver outcomes. And we know that caregiving research is actually a national priority, given these challenges. So I mentioned I had data to share. This comes from a study of caregivers and patients who were diagnosed with brain tumors. And you can see in blue, we have the patient data. In purple, we have the caregiver data. And you can see baseline is around the time of the patient's diagnosis. And we can see we have data collected 3 months later, 6 months later, 9 months later. And you can see in terms of depression, it sort of flip-flops who has more or less depressive symptoms. Is it the patients or is it the caregivers? But when we turn to anxiety, you can see really, truly, it's our caregivers that are experiencing the most anxiety in this population. And I think that this is true in other cancer populations as well. We see consistently that our caregivers have more emotional distress than the patients. And one reason might be because they have no outlet to receive support or not as many outlets as patients do. So speaking of not having an outlet, these are some quotes that we have from caregivers. So different challenges they face, such as having these fears or emotions, but not really having a place to share it. So maybe they are worried about the future, but they don't want to tell the patient because they don't really want to burden the patient with their emotions. Maybe it's the elephant in the room where they're not talking about next steps with their patient. Maybe they're having challenges navigating new symptoms in their loved one. Maybe they're noticing their relationship dynamic change with their loved one. So in this example, in the top right, a caregiver is trying to help a patient complete a sentence and the patient is getting frustrated. So, different dynamics are changing. Or maybe the caregiver is feeling alone. At the time of diagnosis, they're receiving a lot of support. But as time goes on, they're really in this unique position where they are doing most of this work with little support. And we know that all of this takes an emotional and physical toll on caregivers. So we talked about anxiety and depression, but what we know is that caregivers are also at a higher risk for heart disease, sleep disturbance, fatigue, and even mortality, unfortunately. What sadly happens often is in trying to take care of the patient, caregivers have trouble taking care of themselves. Um, so we know that often they're skipping routine health checkups and visits. Um, and we also know that their health, whether we're talking about emotional or physical health, can be interdependent and affect the patient's health. So, if it's hard to justify taking time to take care of yourself as a caregiver, maybe you could reframe it just for today that you're actually helping your loved one by taking care of yourself. So, one way in which caregiving can impact caregivers physically is through the stress response or the fight or flight response. So I have an image here on the left that talks about all that changes when our fight or flight response is activated. Um, and what we know is that stress is stress. So this fight or flight response was developed when we were cavemen and women, and we were having to either fight or flight, run away from a lion's, tiger, or bear. But now we have problems that you can't directly fight, physically fight, or run away from. And so that activation of that system can be really, really draining on us. And so one thing that we want to help caregivers move from is from fight or flight to a more rest and digest state. So more relaxation. Now we know that some stress is important, right? We can't just be resting and digesting all the time. Sometimes stress is adaptive to help us accomplish our goals. But we know that extensive stress over time, in the general adaptation model, as you can see here, can really lead to exhaustion. And that's what we want to avoid. So let's move on from here and talk about different strategies that we see in the research and that I found clinically that help our caregivers. So how do you take care of yourself while taking care of someone else? And I just want to first off and say that this is more difficult than I'm going to make it sound. I hear you. I understand. It's not that easy. It's not that simple. And I hear that you're trying as well. And so I don't want this to become a presentation where I'm telling you you're not doing enough, you're not taking care of yourself enough. And I hope instead you can leave today with just one additional strategy that you haven't tried, um, or with the message that your needs are important and that you're not selfish for taking time for one of these strategies. So we've got a lot of different strategies to talk about. All right. So the first thing I will say when coping is that we've got two different choices for coping. We can use something called problem-focused coping, or we could use something called emotion-focused coping. So problem-focused coping is taking action to directly resolve the situation. So there's a problem and you can directly fix it. Maybe you have a problem with someone that you work with and you can talk to them directly to resolve the situation. Emotion-focused coping is equally as important, and it's really important when you can't resolve the situation directly. So instead, you're trying to manage the stress or discomfort. So let's just say in the same situation, you have someone that you work with who's difficult and you've tried talking to them and you can't really leave your job and you're sort of just stuck in that situation for maybe a time limited period. And so you're just trying to make yourself feel better about that. So you're just trying to take care of yourself. And you could see here as a caregiver that there's probably situations where you would need problem-focused coping, and there's probably situations where you would need more emotion-focused coping. I like to think of these two types of coping styles as what is in your control and what is outside of your control. And so, sort of the first strategy when you're noticing difficult emotions is to sit with that emotion and to brainstorm, either out loud with someone or pen and paper, um, this situation that is causing me anxiety or causing me distress. What can I actively do about it right now? And what are aspects of this that I truly have no influence or control on? So, if we were to take an example of a snowstorm and we were to apply these two buckets, right? Looking to the right first, what's within your control. So, if you know there's this snowstorm, you can stock up on supplies. You could maybe stay with a friend if they lived closer to where you needed to be for work. You could maybe leave work early. You can move your car off your street. So these are all actions. These are all problem-focused coping strategies. But there are inevitably going to be aspects of a snowstorm that you cannot control. You won't know exactly when it's coming or how much snow there will be, what areas will get the hardest, if there's going to be a power outage or not, if there's going to be road closures and delays. And with these things that are understandable worries, this is when we need our emotion focused coping skills. And we're going to talk about what some of those are. So I want to pause here for a moment and I want you to think about with caregiving, what are some aspects, some challenges that are within your control, and what are some aspects that are outside of your control? And I'm going to give you just a couple of seconds to think about this. So oftentimes, what I hear from the caregivers that I work with is that, if a patient has a new side effect, they know that they could send a patient gateway message to the provider. They know that they could bring it up at their next appointment. They could ask someone in a support group. They could research it online. They could track this symptom. Um, they could try a treatment that's worked for the symptom in the past, maybe. These are all things that they could try. But there's an aspect of the situation that is causing them distress outside of their control, which is, what does this symptom mean? How will this impact their treatment? Does it mean that the end is coming? Um, what will this mean financially? A lot of unknowns are really in that uncontrollable category. And I kind of switched us from left to right here. But for those problem focus issues where we need problem focused coping, those are moments where you make a decision, you resolve the conflict, seek information or advice, set a goal, engage in problem solving, request help. I think requesting help being one of the biggest one that applies to caregivers. Whereas for those things outside of your control that are really coming from a place of uncertainty and fear, that's when you do your best to let go of those worries. So we want to acknowledge that they exist without them controlling all of our day, right? And you say, I hear you worries, and right now I can't do anything about it. So I'm just going to try to make meaningful, enjoyable moments for myself or with my loved one. I'm going to do some relaxation. I'm going to do some self-soothing or practice acceptance. We'll talk about this later. I'm going to take care of myself physically and exercise, um, play music, take a walk, talk to someone, write my feelings down, or try to see it from a different perspective. And you could think about how each of these strategies don't change the fact that you're living with uncertainty, but just make you feel better, maybe just in that moment. So, we're going to talk about different emotion-focused and problem-solving techniques. And the first one we're going to talk about is grounding or self-soothing. So, this would fall under that emotion-focused category. So, when you're noticing that you are feeling intense emotions, or you just notice your stress level is high, I think this often, unfortunately, happens right when we're trying to go to sleep, right? We lay down and all of those thoughts and fears and to-do lists pop up in our mind. You want to sit or lie comfortably, maybe close your eyes, breathe slow and deep, and you want to ground yourself to the present moment by using your senses. So you'll look and see what are some things around you? So you'll have to have your eyes open for this one. Name 5 non-distressing things around you that you can see, that you can hear, that you can feel. If you could find some things that you can smell or taste, like I just had some coffee earlier, I can still kind of taste the coffee in my mouth. Those senses are important too. So maybe we can just take a moment here and take a few deep breaths and notice where we are in the present moment. Notice what the chair feels like. Notice how your feet feel on the ground. Notice what my voice sounds like. Can you hear any other background noise? And the great news about this grounding technique is that you can really use this anytime, any place. And it doesn't have to take long. You can just give yourself a 60-second break, and that can be make a meaningful impact. It won't take everything away, it won't change the problem, but it can help in a small way. So other relaxation techniques here. First, I'd just like to say that I love the Calm app and I love YouTube. And you can type in any of these strategies that we talk about today into YouTube and just find a plethora of examples. And I recommend that you do that today. So sometimes there's also meditation hotlines, like numbers that you can call. I think MGH, the Benson Institute, maybe has a hotline. But you can type in mindfulness meditation, which is getting to the present moment. You could type in guided imagery, which is kind of taking yourself for, I don't know, 10 to 15 minutes to a calm, special place. For me, it's the beach. You could practice diaphragmatic deep breathing. We'll talk about that here in a moment. You could practice progressive muscle relaxation, which is a series of tensing your muscles, taking a deep breath and relaxing your muscles to relax your body. Or you could engage in a body scanning activity. And I highly, highly encourage that you try one of these. Give yourself 10 to 15 minutes to try one of these. And everyone has a different strategy that they like more or less. I do think that diaphragmatic deep breathing is sort of the bread and butter of all of these. So diaphragmatic deep breathing is a deep breath in through your nose, out through your mouth. Please practice right now. And really take your time filling your lungs with air. When you breathe in, your stomach will extend. When you breathe out, um, really, really take your time on that out breath. Okay. Other types of emotion-focused strategies to consider. One I'd say is to remember the oxygen mask analogy, which is if you've ever flown in an airplane, is the idea that in order to take care of yourself, or to take care of those around you, rather, you have to put on your oxygen mask first. And I know that caregivers sometimes hate hearing this preached to them and hate hearing self-care preached to them. And so maybe what I would offer today is it's okay if you are not perfect at taking care of yourself. But remember your most basic human needs. We all need to sleep. We all need to eat. We all need to move our body in some way. and we all need social connection. In addition, I'd argue we all need quiet time, whether it's one of those activities we talked about or prayer. It can be really, really powerful. Worry time is a strategy to use where you're sort of setting boundaries on your worry. So maybe you say, I will not let myself worry before bed, but I can let myself come back to this problem in the morning when I wake up. And maybe you come up with a mantra for yourself. So I'd like to offer this one for you. I'm doing the best I can. I will give myself grace during this difficult time. I'm a human being, not a robot, not a superhero. It's okay to have feelings and needs. One thing that I often hear from caregivers is trying to do everything all at once. And so they get into these boom bust cycles, which is what's pictured here on the left, where they're doing way too much. And because they do way too much in a short amount of time, then they're down for the count for a while, and then they're doing way too much, and then they're down for the count. And one strategy that we recommend for caregivers is to pace yourself the best you can. And this may require you to ask for help or giving yourself grace and permission to not do everything, to have a dirty house, or to not do everything perfectly like you used to, so that maybe you're not doing as much. You can see that the level of activity is lower on the right than on the left, but you're also not out for the count as long. So you're avoiding the boom bust cycle, and you're pacing yourself a little bit more. I mentioned that this may require that you ask others for help. I think this is one of the most important strategies for caregivers. So take a look here at the different types of support that caregivers often need. So there's practical logistical support here on the left, emotional psychological support. Do not discount this. This is really important, and informational support. And you can kind of pause here for a moment and say to yourself, okay, what do I have already? And what do I need more of? You might have a lot of help getting the patient to their appointments. Maybe you have a meal delivery drop off, but maybe you don't have a place to safely vent. And we all need that. We all need places to safely vent. Maybe you don't have a place of encouragement. Maybe you don't have a place of connection where you can get knowledge and information and help with these complicated decision making. So take a look here and write down maybe some areas that are going well or not going as well. And then I want you to think about what are all of the different sources of support of your life? And I want you to think as wide as possible. So think about old and new friends, think about relatives, neighbors, acquaintances. What I hear all the time from folks is that, wow, this person that I never thought would be there for me really came out of the woodwork and has been so supportive. And this person that I thought would be there for me, I really haven't heard from as much. So people can surprise you. And, in this brainstorming phase, write as many different names down as you can. And what you're going to want to do is you're going to want to match the type of support that you need with who could really provide that for you. Not everyone is going to be good at providing emotional support. Sometimes you need formal emotional support, I would argue, as a therapist. So once you kind of figure out what your needs are, who's in your circle, I want you to stop and reflect what could be getting in the way of you receiving this support. And these are some things that I hear all the time from caregivers. It's feeling like you can't ask for help. You've already asked this person once. You can't ask again. You don't want to burden people. Maybe people think I need to be able to do this on my own, that it's my job. And I want you to really challenge these thoughts that are getting in the way of you getting the support. Let me just make it clear. As a caregiver, you cannot do this alone. It is impossible. It really, really does take a village. And I'm sure you would not have some of these assumptions if you were speaking to another caregiver. What would you say to a friend? What would you say to another caregiver? Maybe a challenge for you is not knowing how to communicate your needs. And if that's the case, I have a skill for you called DEAR, which stands for, it's an acronym for how to communicate your needs. And the D stands for describe the facts of the situation. And then you're going to explain your feelings related to the situation. You're going to assert your request. You're going to ask for what you need or say no to something. That could be part of this too. And then you're going to reinforce the importance of this request. You're going to put a pretty bow around it. So I'll walk you through an example, but I want you to remember DEAR if you're having trouble putting words to your needs. All right. So let's use an example here. Remember, the first step is to describe the situation just using facts. So here in the blue, I'm having trouble keeping up with appointments, maintaining a clean household, keeping up with my work responsibilities, and getting enough rest, right? So these are just setting the stage facts. Purple, explain how it makes you feel. I'm feeling overwhelmed and tired and would really appreciate extra support. The next step is to assert your request in orange, and I want you to say it explicitly. Could you please help me buy X, Y, and Z? Think about that list of needs that we talked about. Could you please help me by driving my patient to their appointment on Friday? Could you please help me by taking over this work responsibility? Can you please come over and sit with my loved one while I take a nap? And remember the last step, reinforce. You're going to put a pretty bow on it. Doing so would allow me to rest and prepare for the journey ahead, allowing me to be a better caregiver. I really appreciate it. Thank you. So this is just a script you can follow and insert your own request here in the orange when you ask others for help, which I know you have to be an effective caregiver. I know that it requires that. So that was sort of a problem-solving strategy. Let's go back to emotion-focused coping strategies and talk about acceptance and mindfulness. So sometimes you can't solve a problem directly. Sometimes, no matter what you do, you do all the deep breathing in the world, or you go on a walk, or you talk to a friend, you still feel bad about a certain situation, and that's okay. And sometimes those are moments to practice acceptance and mindfulness, to accept that this is just a hard time right now and that you may not feel better. It's okay to not be okay, and to sort of let go the best you can of whatever you're holding on to. And one thing that I like to clarify with caregivers is that accepting a situation that it is the way it is doesn't mean that you approve it, right? You may accept that you won't have answers about the scan until next week. And that doesn't mean you like it or you want it to be that way, right? You just know that it is that way. And so you know that you have to accept that you're going to be sitting with those anxious feelings until you get the results back. One way to practice acceptance is through mindfulness, which I mentioned briefly earlier in this presentation. Mindfulness is awareness of the present moment. The present moment is so important. And when we practice mindfulness, we can do it a lot of different ways. We can sit and just observe the thoughts and feelings and sensations in our body. We could describe those thoughts, feelings, and sensations and put words to them. Or we could just engage fully in the present. I think about things like singing in the shower, dancing, activities that really, really require you to be outside of your head and just in the present moment. I like to say to caregivers that you're going to worry. There's not a world in which you can be a caregiver and not worry. But how can you be really intentional here and balance all of your worries with intentional presence. I think about an ocean, and I think about worries, that feeling of where you're drowning, where you feel overwhelmed, are often in those moments where you're really worried about the future, or maybe you're beating yourself up about the past. Joy is found only in the present, on the shoreline. And so, if you can challenge yourself to engage in activities that bring you to that shoreline, to that present moment, to balance your worries, that is really, really, really powerful. We talk a little bit more about how to do that. I think the most important way to do this is to think small, right? Well, oftentimes your life has really changed since the patient was diagnosed. Um, maybe you used to go on these like epic fishing trips, and that's not really possible anymore. How can you find small moments of joy, like share a giggle here and there? Sometimes we have these grand ideas too of like, these epic vacations that we could take. And, I think in my family and maybe in yours as well, that, even in those like grand, awesome vacations, there's still stress and, things don't go perfectly because that's just the messiness of life, right? And so just because you're not planning something big, that's okay. There's still small joy to be found in and smaller, less epic activities. And it's okay to do these activities with fear in the background, right? It is possible to feel both hopeful and afraid at the same time. And if you're having trouble finding hope right now for whatever reason, what I might ask is, how could you redefine hope? Maybe your loved one is diagnosed with an incurable disease. So maybe your hope is not that there will be a cure. Maybe that's part of it, but maybe you've expanded your hope to mean I want to enjoy as many silly moments with this person as I can. And I know that every day won't be sunshine and roses and butterflies, but I know some days will, and I really want to capitalize on those moments. And so, one last activity for us, and then I'll talk about support, is to be really intentional about all of the different activities we've talked about today. To be intentional in your care of yourself, to make a plan. And maybe we could start by thinking about a pleasant activity that you used to like to do by yourself or with the loved one that you care for. I want you to pause, and maybe if you're watching this later, to go get a piece of paper and a pen to really write this down. Think about all the different things that you enjoy now, or maybe you used to when you had more time. And we're going to think about ways you could incorporate it back into your life in a small way. Remember, it doesn't have to be in that big epic way. It can be in a small way to honor that thing. Think about how you could do it differently. Be creative. Think about what could get in the way, how you could overcome that obstacle. What would be a plan B? And then I want us to make a specific plan. All right, and I have a great example for you, and you are welcome to steal this one. Maybe you used to like to travel, and maybe your loved one is on treatment right now every few weeks, and you just know that there's not going to be a break in their treatment. And so you can't do that. What could you do instead? Okay, what about if you were to watch a travel show on a place that you've wanted to visit? And maybe while you're watching it, you could order food from that country, from a local restaurant, and eat that food while you watch it. Um, I think that could be fun. Of course, it maybe isn't the same as going, but I think that could still be a small moment of joy. Think about what could get in the way. Maybe not enough time, maybe it's not enough energy, maybe it's hard to stay awake in movies. How can you overcome that obstacle? Maybe you plan ahead and you block out just one night and you ask for help. So maybe you ask a neighbor or another family member to help facilitate this, that, you want to plan this one special night next week. Could you come over and watch the kids or take the kids? So here's a specific plan. This week, Wednesday night, mother will watch the kids. We will choose a show on Greece, and eat food from a Greek restaurant while we watch. Remember small things. Okay, so I hope that you have a plan and you have the validation and encouragement that this is important. Your emotional well-being, your health, your needs are important. And I hope that you're able to execute this plan. I want to end our time together just briefly discussing the support that is out there for caregivers. And this is not, this won't be have everything, but this will have some ideas of things that are happening at MGH and beyond. The reason why I want to bring this up is one of the most common experiences I hear from caregivers, both clinically and in my research, is loneliness, right? Because being a caregiver is a really unique role. I mean, sometimes you are the person delivering medical news to other family members and friends, and sometimes you're the one who's really seeing the patient and their suffering and maybe sheltering others from seeing that, or sheltering the patient and protecting the patient's dignity and not sharing some of those things with other friends and family members. And so it can be a lonely journey at times. And so I would really, really encourage you to connect with one other caregiver. If this was an in-person session, I would love for us to all meet each other and maybe we'd exchange phone numbers, but maybe through some of these support services, you could get involved and meet another caregiver that way. So, if you're ever in a crisis, please, please get help. We've got these different suicide prevention hotlines. There is research that suggests that suicide is higher in caregivers of patients with cancer than spouses of people that don't have cancer. So please, if you're in urgent need of help, please call 911 or one of these hotlines. But if you're not in crisis, I want to let you know of a few different support opportunities. The first on this left is this really, really awesome group. It's called the Mindful Self-Compassion Group for Caregivers. This is led by a psychologist in our center, Carrie Murphy. I think it is full right now, but she has a wait list. She certainly always has way more caregivers than she can accommodate, but we're hoping to change that systematically at MGH. But she's created this group for cancer caregivers to practice some of the skills we talked about, that mindful self-compassion approach, giving yourself grace, making time for the present. And so if you're interested in that, you might share that with your loved ones, oncologists, and they might be able to get you connected to this or one of the services on the right. We've got a caregiver mentor-mentee program, so you can be a mentor or a mentee and be connected with another caregiver at the Cancer Center. We've got the parenting around a challenging time group. So this is a group that helps with parenting when your loved one has cancer. We've got a brain tumor caregiver group. We've got a couples with advanced cancer group. And I think we have a bereavement group up and coming. I don't think it's totally online yet. So we've got some disease-specific resources. Beyond MGH, or no, still within MGH, but research studies, I'm not totally sure what the status of these two studies are at this exact moment, if they're still actively recruiting. But we have the young adult dyad study and the BMT, so bone marrow transplant caregiver study ongoing at Mass General. If you're interested, you can contact Laura or Madison for more information to see if you're eligible for these two studies. And then beyond Mass General, I have some of these websites. This presentation will be shared online. Another great idea is to go to a association or a website for the diagnosis that your loved one has. So, for example, If you're a caregiver for a patient with a brain tumor, you could go to the American Brain Tumor Association's website and look on these disease-specific websites to see what resources they have for caregivers. Because almost everyone sees and understands that caregivers need our support and our help. And with time, I hope to see some systematic changes at our institution and otherwise in our national policy so that we can continue to support caregivers within our institution walls. So that's all I have for you today. Thank you so much for your attendance. Congratulations for taking the time to focus on yourself just by attending this presentation. Please keep setting intentions for self-care and follow through the plan you made for yourself. If you have any questions, I'll take those now, or this is a couple other ways to contact me. So thank you again.
Thank you, Dr. Willis. We are now at the end of the session. If you have any questions or even thoughts you'd like to share, feel free to do so in the chat. Dr. Willis, you had reviewed earlier on in your presentation the Cancer Research Program. Is this only open for medical providers, or can caregivers be part of it in any way?
No, this is actually only for cancer caregivers, not for medical providers. The thing about our research program, there's pros and cons. One, we are one of the few in the nation that have a cancer caregiver focused research program. However, these research projects depend on grant funding. So when the project is over and the grant is over, the study is over. So we're no longer providing that supportive service for caregivers for that particular study. So in that way, it's always in flux, what research projects we have open and if we're actively recruiting or not. I mentioned those two at the end, the young adult dyad study and the BMT cancer caregiver study. But there's been a lot of other projects in the past, like we had a treatment for anxiety in caregivers of patients with primary malignant brain tumors. We had our Coping with Caregiver study that was a multi-site study between here and Memorial Sloan Kettering. And so it's always in flux. Check our website. Feel free to send an email to Jamie Jacobs or to the other two people listed, Madison or Laura, and they might be able to tell you what's available. Or you can always email me as well to see what we're actively recruiting for.
Thank you. And aside from seeing what's currently available, do you know in general if the caregiver needs to be a patient at Mass General or their loved one be a cancer center patient to be part of it?
Yes. The majority of these will require that the patient is receiving care at Mass General. Sometimes we will open it to Mass General or other affiliate sites or at Dana-Farber sometimes. So sometimes we'll open it depending on the study, but for the most part, they do need to be a patient at Mass General. And if you're not at Mass General and you're watching this presentation, your institution may have other supportive care services for caregivers that don't depend on research funding, or they may actually have a research study open for caregivers. So feel free to look into those and check those out as well.
Thank you. You had shared some wonderful tips throughout your presentation. Are there any specific tips that you can share with someone who is new in the caregiver role?
Oh, man. Well, we know from research that sometimes right at the time of diagnosis, that is the most stressful time. That's a time where caregivers report feeling overwhelmed. And sometimes they don't only feel overwhelmed with, the patient's diagnosis and the treatment plan, but they feel overwhelmed with all of the support they're getting, actually. And we know with time that sometimes that support dissipates. So what I would say for a new caregiver is, give yourself permission and grace during this time to not get it all right, to not remember everything that the doctor says perfectly all the time, or to not reply to every text message of support that you receive. Um, because you can always go back and text that person later, or you can reach out to that provider again. So give yourself grace. Find people who can help you manage all of the tasks. Like maybe you can designate someone who communicates, who sends out email blasts to all the people that care about this patient on your behalf, so that you're not responding to, 100 people every day and giving them all the same piece of news. Um, and to when you're feeling ready and maybe not as overwhelmed, to find another caregiver to connect with, that you can build relationships with. And that could be even just on a Facebook group. It doesn't have to be in one of these in-person groups where you can send a message to at midnight and say, hey, I can't sleep. I have this on my mind. Can we talk? So those would be my tips. Give yourself grace, find people who can help you, and designate tasks and roles for these folks, and find another caregiver you can connect with.
Yeah. We have an audience member who shared a comment that you shared excellent practical screens to use. They would also like to add setting boundaries around negativity or time wasters. This person also really liked the self-soothing breathing techniques and practicing.
Oh, I love it. I love it. That's so great to hear. And setting boundaries, that DEAR framework I talked about where you're asking for help, don't forget that you can use that same framework to say no, to say, you know, I noticed that you've been checking in a lot. I'm feeling overwhelmed with the number of messages. Could you please limit your check-ins to once a week? Right? So that's saying no in a way. That would really mean a lot to me, and I appreciate your understanding.
Thank you. What tips do you have on how one can find a balance between being a caregiver and being, for instance, a daughter to their mother with cancer?
Oh my goodness. This is a hard question. First, let me share an analogy that I heard that was really helpful for me. When you think of the idea of balance, you could think of like a spinning top, okay? And how about the top is balancing on that one little point. But eventually, even a spinning top topples over, right? Balance is a great idea in theory, but we can't always balance things. So let's just first say that do the best you can and know that you're not going to get it right and you're not going to get it perfect all the time. Ideas I have for you, I think probably the role of being a caregiver, you don't need help with. Like that's just going to come naturally, and um, the situation will necessitate that you do what you have to do, right? Like you'll go to appointments, you'll manage medications. Like that part I think is easy. I think the harder part is like, how do you maintain that relationship beforehand? And there's not a straightforward answer. Part of it is accepting that all of our relationships change all the time. Your relationship with your mom right now is different than it was before her diagnosis, but it's also different than when you were a baby or when you were a teenager, right? Thank God. Um, so it's okay for our relationships to change. Like that's a natural part of life. If there's an aspect of that relationship that you really miss, use that small moments of joy framework that I talked about. What was that thing that y'all did together that you really enjoyed, and how could you honor that in a very small way, right? Maybe you used to go on long walks and she's not able to do that. I know the weather's not great, but maybe when the weather's better, maybe you could just go sit in a park together and talk instead of going on that walk. So just trying to find small ways to honor um, those nostalgic aspects of that relationship, but also accepting that everything changes.
Yeah. While we wait to see if there are any additional questions in the chat, do you have any final thoughts you'd like to share with the audience?
I would just like to say that I am humbled and honored to be in the presence of caregivers, that y'all really teach me a lot. And you all are in my hearts. And I hope to continue to give back to this amazing group of people in my clinical work and research. And I'll be thinking of you. So just know that I see you. I'm so touched and impressed by the work that you do. And hang in there.
Thank you, Dr. Willis. And for everyone who joined us, thank you so much. As I had mentioned, today's program is being recorded. Dr. Willis has shared a wealth full of resources that you can add to your toolbox. You can watch the recording. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone.
Thank you so much.
Take care.